Top 10 essay topics about ADHD. Attention Deficit Hyperactivity Disorder, Diagnosis and Treatment. According to statistics, almost 9 million American adults and 6 million children have ADHD. The symptoms can vary, but the most common are lack of concentration, forgetfulness, and emotional imbalance. These symptoms change as a person ages, but more often than not, people with childhood ADHD still suffer from the condition in adulthood. What is the difference between diagnosing ADHD in a child and an adult? How are the symptoms different? We invite you to discuss these issues. How ADHD develops into adult ADD. ADHD is a recurrent and long-lasting condition that begins in early childhood and persists throughout adulthood. When ADHD persists into adulthood, it is called Adult Attention Deficit Disorder, adult ADD. In childhood, ADHD symptoms include forgetfulness, frequent distractions, and careless mistakes. These symptoms develop and change to procrastination, poor time management, and impatience. How are the two conditions different? Discuss this question in your essay. Working memory in attention deficit and hyperactivity disorder, ADHD. The most widely accepted models explaining the causes of ADHD attributed to deficits in overall executive functions, such as impaired inhibitory control and working memory. By definition, working memory is the short-lived ability of the brain to retain information necessary to guide present and future behaviors. How is it connected to ADHD? This question is worth exploring. Foods that affect children with ADHD/ADD. ADHD therapy includes medication, behavioral therapy, and diet. According to some studies, up to 50% of hyperactive patients benefited from diets without artificial flavors, artificial colorings, and some natural chemicals such as salicylates in berries, tomatoes, and apricots. Many families with hyperactive children reported some improvements in their children due to their diets. Can food affect ADHD patients? This question is of great practical importance. Cognitive behavior therapy in children with ADHD. Cognitive behavior therapy, CBT, is a set of intervention strategies devised to cause behavioral changes among children with ADHD symptoms or other similar conditions. Even though skeptics maintain that CBT is a short-term intervention strategy, research indicates that the coping skills imparted to individuals with ADHD remain viable even after the withdrawal of the interventions. In your essay, you can focus on the effectiveness of CBT in treating ADHD. Medication and its role in the ADHD treatment. For many decades, ADHD has been treated using stimulant medication. As far as its efficacy is concerned, medication is essential in controlling the symptoms of ADHD. It improves attention by helping brain chemicals work better. ADHD medicines improve one's attention and concentration by targeting dopamine and norepinephrine. However, if used alone, they won't be effective. We invite you to discuss the role of medication in treating ADHD. The neurobiological basis of ADHD. Discussions around ADHD have been going on for decades. Although skeptics consider this syndrome to be fictional, several studies demonstrate neurobiological differences between healthy people and people with ADHD. For example, in children with ADHD, the areas of the brain that regulate memory, emotions, and behavior are smaller. In your essay, you can explore the neurobiological factors that contribute to ADHD, focusing on brain regions and neurotransmitters involved in attention regulation. ADHD in adolescence. ADHD is usually diagnosed before 12, but sometimes it is not diagnosed until adolescence or adulthood. Late diagnosis of ADHD entails certain risks because adolescents with ADHD are more prone to impulsive behaviors, including substance use and unsafe sexual activity. In your paper, you can discuss how ADHD symptoms affect academic achievement and social interactions in adolescence. Another idea is to focus on the significance of support systems and coping strategies. ADHD and co-occurring conditions. Like many other mental disorders, ADHD does not exist independently but is often accompanied by other conditions. The latter include depression, anxiety disorders, bipolar disorder, and personality disorders. This topic implies exploring the common coexisting conditions with ADHD and the complexities of providing comprehensive treatment. ADHD and gender differences. According to research, boys are 3 times more likely to be diagnosed with ADHD than girls. But this does not mean that boys are more prone to ADHD. Most likely, this is because the symptoms of ADHD in girls manifest themselves in different ways. For example, boys with ADHD usually show aggression and impulsivity. On the other hand, girls with ADHD typically show symptoms like inattention and low self-esteem. Gender differences in the prevalence of ADHD are an exciting research topic.